Good morning, CA1s. Today you're going to learn about anesthesia for a trauma or emergency situation. A lot of the concepts are things you've covered already, but you'll learn how to apply them in this setting. As you continue learning and as you go to traumas at your Denver Health or university rotations, you're going to be very intimidated. Traumas can be incredibly daunting initially, but just relax, take a deep breath. You're going to do great. Just remember everything you've learned. Your first objective is to revisit your airway management materials and consider how airway management is different in trauma than for elective cases. You should also think through how you might manage a patient who has facial or neck trauma and what things you're worried about in that kind of a setting. Your second objective is to consider all the types of injuries that can be sustained in traumas and how they might affect your anesthetic management. Would you do something different if somebody had head trauma versus intrathoracic versus intra-abdominal trauma? Then think through the physiology of various trauma scenarios and how your management might change. Your third objective is to go over fluid resuscitation. Now, you're going to cover this or have already covered this in other lectures for this series, but this is very important. So really take the time to go over what your goals for IV access are in trauma patients, consider the IV fluids and their different roles in trauma, and familiarize yourself with the characteristics and capabilities of the rapid infusers. There's some really good videos on YouTube that go over the level 1 and the Belmont and how to work them. And this is very important because the last thing you want is to be in the big gunshot wound case when you're giving a ton of blood and not know how to use the Belmont. Your next objective is to understand what drives trauma-induced coagulopathy and how best to resuscitate a patient who has undergone a trauma with blood products. I included an article from JAMA in 2015 that investigates optimal blood product ratios. I definitely recommend that you check it out at the end of this video. And lastly, you should understand the process of massive transfusion, when it's indicated, when you should be considering it, and how you go about ordering it. Now, it gets tricky because every hospital we rotate at has a different process, but you should familiarize yourself with the process at your particular rotation site. You'll also discuss transfusion strategies and utilizing thromboelastography or TEG in a trauma. As a little word of advice, would recommend downloading a TEG interpretation graph to have on your phone, something that's easily accessible at all times, just until you commit it to memory. And here are some compiled resources that you can use to aid your studying today. I would really recommend the trauma-based curriculum on the Anesthesia Toolbox if you have a login for that. It has a lot of really useful modules that you can go through that really target your learning to the objectives we discussed. And I wanted to call your attention to all of the different podcasts that are available related to this particular topic on ACRAC. It's a little unfeasible to listen to them all in preparation for your lecture tomorrow, but I wanted to make you aware that they exist.